Good morning. Senator Scott Jensen from Carver County here, and I just want to say thank you to all of you who have come. This morning's press conference is, if you will, it's about a triangle, and the whole triangle centers around the patient. We've got 3 bills that we'd like to broach with you. And these bills came from the 2017 formation of the Senate Select Committee on, the Senate Select Committee on the Healthcare Consumer Access and Affordability. I never did like the name. But anyway, what we're really talking about in that select committee was access and affordability for the consumer. And what we talked about in that select committee for more than a year was pharmaceutical pricing, which is a labyrinthine mess to say the least. We talked about low-value services and how could we reduce the frequency with which those services were done. We talked about affordability and access. We talked about transparency throughout the entire healthcare industry. We talked about tiering and tort reform. We talked about the essential health benefits and emotional well-being for patients. And we talked about rules, regulations, rebates, and reinsurance and how that works to solve or exacerbate problems. Today, what we're going to talk about is 3 specific bills that get at the heart of what we talked about in 2017 and 18 when Senator Gizelka formed this committee. We're going to talk about mental health access. We're going to talk about some sort of a prescription drug affordability commission so that when a new product comes to market, if someone wants to set the price at $500,000 a year, tell us why. Recently, there's been a product released called Zolgensma, and it's a gene splicing therapy for spinal muscular atrophy. You may or may not have read about it. What's the cost of the dose? $2.1 million. So how do we pay for a $2.1 million drug? And then lastly, we'll also be talking about a rate cliff that was created, and the state-based tax credit bill that's going to be discussed today briefly would smooth out that rate cliff. In Minnesota, if you make 405% of the federal poverty line, you're out of luck. You're not going to get much support. You're not going to get much help. You'd be better off cutting your income or quitting your job and getting to 390% of the federal poverty line, because then there's a lot of support for you. And so we have the ability to smooth that rate cliff off. So what I'd like to do is I'd like to introduce my cherished colleague, Senator Matt Klein, and have him go a little deeper into the weeds. Thanks again for coming.
Well, thank you, Scott. I'm Senator Matt Klein from Mendota Heights, and thank you all so much for coming today. It's a privilege to work with these physicians and also Dr. Alice Mann, who could not make it today as the bipartisan doctors caucus here at the Senate. So when Scott and I were elected in 2016, there had not been physicians in the legislature for over a quarter century. When we two joined together as the first physicians in that amount of time. And in 2017, in response to that, as he says, Senator Gizelka sent up the special committee to give some physician input into the medical issues facing our state. And then in 2018, 2 more physicians joined us, Kelly Morrison and Representative Alice Mann, so that we have a doctors caucus of 4 bipartisan legislatures now. We have different parties and we have different practices in our clinical world, but we know something from talking to our patients, that if you ask Minnesotans what are the most urgent healthcare issues facing them today, they will say that drugs are too expensive, premiums are too high, and we are not adequately caring for our mental health needs. And these are 3 bills which emerged from that special committee and are supported by all of us, designed to address those concerns. Unhappily, the band is breaking up. We will not have 2 of these physicians in the next session after 2020. Representative Alice Mann is retiring, as is Senator Scott Jensen. So this is our last session and our last opportunity to speak with our bipartisan physician legislator voice. The Drug Affordability Commission, let me make 2 points about that. First is that insulin is really the spark that has lit the flame on this. Insulin is a relatable issue because diabetes affects a broad swath of society, and we know that it's a cheap medication which should be affordable and accessible to all. But having addressed that problem and working to solve that problem opens the door to every other medication which is life-saving and essential: anti-epileptics, antihypertensives, anticoagulants, inhalers. And how will we address price gouging on those questions? The second point I want to make is that pharmaceutical manufacturers are commendably driven by innovation and profit. And that is what allows them to create the miracle drugs that allow us to do our good work. But within their ranks, they have bad actors who are overpricing certain medications because they can. The classic example being epinephrine, a cheap medication to manufacture and produce, essential for young people who have bee sting allergies or peanut allergies, which now markets, I believe, at approximately $400 per unit. It's inexcusable, and it's simple price gouging. Minnesotans deserve a government oversight commission which can intervene in those situations. The second bill is tax credits for high premiums for our farmers and our entrepreneurs who are purchasing health care on the individual market. These people know that their premiums are in excess of 15, 20% of their incomes at times. This bill would cap that at 9.6% of their incomes for all earners across Minnesota. And finally, mental health. We want to create a system where patients in Minnesota are guaranteed by their plans to receive at least 4 visits at a low premium, low deductible, $25 per visit, 4 visits a year with a mental health provider. That's what we're trying to accomplish with these 3 bills, and they enjoy our support, and I'd like to turn it over to Representative Kelly Morrison.
Thank you, Dr. Klein. Good morning. All of us need a medication at some point in our lives. Some of us need medication every day. We have all become aware that the price of prescription drugs has accelerated in a way that has put some life-saving medications out of reach for some Minnesotans. As a physician, I encounter this every day in my practice. The tragic case of Alex Smith losing his life because he was forced to ration the insulin that he needed to live shocked many, but not all of us. Many Minnesotans are struggling to afford the medicine that they need. Others are afraid of becoming sick because it will leave them bankrupt. The out-of-control cost of prescription drugs has reached a point that action is required. The state has the legal authority and, frankly, the responsibility to take action to address this problem. Our bipartisan Prescription Drug Affordability Commission is one way to do just that. I'm proud to stand with my physician colleagues today. If you believe in the concept of a citizen legislature that brings together people from diverse backgrounds with different skill sets to make policy for our state, I think it's important to have people with scientific and medical training in that mix. I've enjoyed the camaraderie and collaboration of our Doctors Caucus, and losing Senator Jensen and Representative Mann in the legislature next year is a loss for our state, especially Representative Mann. Just kidding. Just kidding. The 4 of us have different takes on how best to improve our healthcare system as well as the overall health of the people of Minnesota, and I think that that is actually a strength of our collaboration. We share a passion for our patients and our state, and we all agree that we must find ways to make the prescription medicines that Minnesotans need to thrive more affordable. And with that, I'd like to introduce Will Phillips from AARP.
Thank you. Good morning. My name is Will Phillips. I'm the state director with AARP Minnesota. We are a nonprofit, nonpartisan membership organization with more than 650,000 Minnesota members. And I think the one thing for us that is loud and clear year after year is that the high cost of prescription drugs is a major challenge, a major pain point, and a major concern for our members. We want to applaud Senators Jensen and Klein as well as Representative Morrison for their leadership introducing this legislation to create a Prescription Drug Affordability Commission. Americans pay the highest drug prices in the world, and lowering these drug prices is a critical need for our state. Recognizing that prescription drugs are a public good and they're universally needed is no different than the way that we think about public utilities, telecommunication services, electricity, natural gas. And just when the basic health and safety of our citizens is at risk when electricity or natural gas becomes unaffordable, the same is true when people cannot access the medications they need. We have countless stories of our members and others who demonstrate just this. People like Claire Henn in St. Paul, who was diagnosed with rheumatoid arthritis. When the cost of her Remicade went up, she had to make the decision to stop taking that in order to afford housing. Or Tom and Sue Counters down in La Crescent with a diagnosis of breast cancer are seeing that their out-of-pocket cost, even with insurance for their medications, is $12,000 a year. They can afford it, but they're not sure how much longer they can. And another member who's on a specialty drug where the cost is nearly $50,000 a year. Now, the pharmaceutical company, through assistance programs, is picking up $3,500 a month of that. She calls this an insane shell game. And that's really what this is all about, is where these costs are being picked up. This issue impacts us all, which is why AARP, with our members across the state, really believes that this is an issue that has to be dealt with. Whether it's the cost of insulin, epinephrine, you name it, this is an issue that is a trend that's not going away. We passed out a copy of our AARP bulletin, and I think the front cover says it all. It says, "Nothing stops drug companies from charging the highest price the market will bear. The result, prices that make little sense but lots of profit." And we believe this legislation will go a long way towards addressing that very issue. Thank you.
And thank you, Will. You might be wondering, what's the status of these bills? That's depressing. These bills aren't getting hearings. The Senate Select Committee created in 2017 said, we want your expertise. Well, the Doctors Caucus speaks together. We think that a state-based tax credit can make health coverage, health insurance, more affordable and more accessible. And we'd like to have a hearing on it so we could talk about it. This is an idea that Senator Tony Laurie floated many years ago, and it's a good idea. On the Prescription Drug Affordability Commission bill, this is what Canada does, this is what Germany does. Basically, when a new product is coming to market or a generic product is going to increase by some 200, 300% in a given year, tell us why. When these bills don't get hearings, we're forced as physicians to seek some other platform. And so we utilize you, because oftentimes the best work we do in the legislature is pushed forward by the coverage that media provides to the people of Minnesota. And that oftentimes serves as a catalyst to get something worthy done. So disappointingly, of these 3 bills, I've already been told that on 2 of them, we will not be getting a hearing in the Senate. The mental health bill still has a chance, but that's disappointing to say the least. When I went out to Washington, D.C. and presented the Prescription Drug Affordability Commission to the National Governors Association a year and a half ago, they were excited. They're still excited about it. It's been proposed in Vermont, Maryland, Kentucky's talking about it, but we can't get a hearing. So if we don't have a hearing, the people in Minnesota won't hear about it. So with that, I think we'll open up for question and answer. Thank you. Please.
Senator Jensen, what are the concerns in your caucus or at the committee level about taking up those 2 bills you mentioned?
I think with the state-based tax credit, I think that because it's addressing a rate cliff that was formed through the Affordable Care Act, that might be perceived as trying to fix the Affordable Care Act. I think that that's problematic for some in my caucus. To me, what we have today is the Affordable Care Act. Let's make it work as well as it can. I don't think we need to sabotage it. And I'm going to ask my colleagues in the medical profession to speak to that issue as well. And then to the other bill, I think in terms of the Prescription Drug Affordability Commission, it just smacks of too much regulation. And I would simply say, I think we have a thing called a PUC, which helps control how much our utility and our electrical costs might go up. And I think that's done a good job. And I think without that, I think we might be paying a little bit more for our electricity. Thank you.
Yeah, I think the resistance, again, is a concern about excessive regulation, particularly on the pharmaceutical industry. But, you know, the point is made, we've discussed this at the Blue Ribbon Commission. Other countries have less expensive medications, and why is that? Is it because we're subsidizing them as Americans, or is it because they have a sustainable market and we have an excessive market because we have not sufficiently regulated? And the answer appears to be the latter, that drugs are cheaper in Germany and in England because they're willing to pass laws like this Consumer Oversight Drug Affordability Commission, and we have been less willing to do so. So they have sustainable markets, we have gouging markets, and that's simply the choice we need to make as a society. So.
Did you tell Senator Gazelka you were going to do this, Senator Jensen? I mean, obviously, this is a clear shot at Senate Republicans. I don't think we're talking about the House Democrats here or the Senate House.
Ms. Murphy, excuse me. This is not a shot. This is an olive branch to extend the opportunity for enhanced bipartisan approach to important issues. Senator Gazelka's schedule is very busy, and so I didn't get a chance to extend an invitation to him. But he's aware of these bills, and so are the chair people of the Senate. So when the decision is made to not hear these bills, physicians are not a quiet bunch. We don't go quietly into the night and say, oh, okay. We think that that's problematic. These bills should be discussed. We should not be allowing pharmaceutical companies to come out and say that we're going to price this at $500,000 a year, or that, oh, by the way, this drug, now that we've got a foothold on the market, we're going to bump its price up 200%, and we're not telling you why. So I don't see it as a shot. I see this as nothing more than, we can't let the political parties determine what's a partisan issue and what's not. Healthcare is not a partisan issue. It's a Minnesota issue.
Can you address, perhaps in your practice, you probably see farmers who outwardly would appear to have a fair number of assets, but under the Affordable Care Act, because they are purchasing their own insurance, their premiums are extremely high. Have you run into that in your practice?
You're exactly right. And a lot of those people make just enough that they're over that 400% mark. So I have many small business people and farmers that literally what they'll do is they'll come in once in a year and say, okay, doc, this is going to be my no expense year in healthcare because I don't have any insurance or I have a huge deductible. And so they'll come in and they'll say, now, if I do this now, I can skip next year, and then I'll come in the following year and I'll do the physical and I'll do the cholesterol. But will you fill my meds for the next 15 months if you don't see me? They'll negotiate with me. They're very responsible stewards of the dollars that they have in their family. And frankly, in their family, they have higher priorities. They're trying to take care of their children. They're trying to make sure that their children are well cared for. The education piece, the whole thing. I see it every day. It breaks my heart. It breaks my heart that we're making people make choices as to, how am I going to take care of my congestive heart failure? I can weigh myself. I'll decide how much Lasix I'm going to take, how much I'm going to make myself pee that day if my weight's too high that morning. This is crazy stuff. As Senator Klein said many times, we're better than that.
Considering that two of the bills aren't getting hearings now and a couple folks from the Doctors Caucus are not going to be here moving forward, how concerned are you that these bills just die and don't get anywhere?
That's a great question, and I think that's exactly why we needed Senator Klein here and the representative, because they can carry the ball forward if it doesn't get done this year, which it isn't looking very good. So I would hope that they would not drop the ball.
Can one of you speak a little bit to how you envision the transition between the reinsurance program and the tax credits that you've proposed, how that would work, and what the justification is for that change?
Sure, yeah. So I've been an occasional critic of the reinsurance program as kind of a public subsidy to the insurance industry. And the concept here would be that let's send those dollars directly to the people who have high premiums. Let's send the same dollars that we're using for reinsurance currently, and instead of sending it to Blue Cross, let's send it to Farmer Smith or small business owner Jones, because that's the kind of intent and I think the concept behind these tax credits. So if you have a high premium that's 15% of your income, let's make sure that comes down to 9.6 at least.
And it might be important to realize too that I don't think that reinsurance and the state-based tax credit are in conflict with one another. I think that the state-based tax credit will simply smooth out the rate cliff that exists at 400%. So then we can see some of that 6% of Minnesota that's not covered. We can see a lot of those folks go ahead and be able to get a silver plan that would be more affordable. If you're below 400%, the way those structures, those schedules are built is you will be about 9.6% of your adjusted gross income would be the maximum you would pay if you're under 400%. If you're over 400% of the federal poverty guideline, you would be potentially paying 25, 28, 30% of your adjusted gross income for that same silver plan premium. And if I could, 400% of the federal poverty guideline for a family of four is about $100,000. So if you've got a mortgage and you're having to pay 28% of your AGI towards it, that'd be $28,000 for your principal, for your premium. Then you'd have your $4,000 or $5,000 deductible set. Now you're $33,000 for your family. If you have a diabetic or two in your family and you don't have that same deductible for medication coverage, you could be another expenditure. You could conceivably easily get to $40,000 to $45,000 of healthcare expenditures alone. And so then the family of four has to live on $50,000 for the rest. And that has to include everything, including food, home, and all that. So I think that the rate cliff at 400% is unfortunate. It should really be smaller incremental degradation in terms of cost.
And the tax credit would bring it down to 9.6%?
Thank you for that question. I mean, that's a great question. It would bring it down to less than 10%.
Less than 10%, okay.
And if you run that out to about 550, once you get to 550%, it goes away. Because at that point in time, 10% of your AGI would cover the cost of your silver premium. So it would no longer be necessary. We had some rough fiscal notes in there. It looked like it would cost somewhere around $135 million. And in comparison to some of the other things we talk about, we would really be able to take a huge step towards getting every Minnesotan some coverage. Because of the 6% that aren't covered right now, we know probably half of that are eligible if we would do a better job of getting them plugged into MA and MinCare or to the MNsure exchange. But we do have probably about 3%, give or take, that we need to help, and this would do it.
I think it's about 3% of the population that's.
I think we'd end up
serving
having, if we did the state-based tax credit, I think we'd end up having, of that 6% that's uninsured, I think we'd end up having about half of that be able to avail themselves of that opportunity. But those are rough numbers to be sure, because they change every week and every month.
Thank you all so much.
Thank you very much for coming, very much appreciate it.